You touched on this a little bit earlier, but you know, oftentimes you're fourth, fifth, sixth down the line in terms of a doctor that people will see. What happens in that first doctor visit if someone goes in and diagnosed with neuropathy or fibromyalgia? What's the typical, I guess, standard of care or treatment, and what does that lead to? What maybe is wrong with that compared to what you can do?
Yeah, and it's unfortunately in our country, a lot of our health care is more or less symptom management, as you know. And you know, I'm not a medical doctor, but I will tell you what the average person, or what I've even been exposed to in the past, is you go in, you got a symptom, well, here's a prescription that addresses the symptom. Well, the question people never ask, for whatever reason, I don't know why, is, well, why do I have this symptom? Why is my blood pressure high? Well, is it that you're 80 pounds overweight? Is it you eat a high sodium diet? Is it you don't exercise? I mean, the problem with America is we want that quick fix. And, you know, we have a medical model that fits that need for a quick fix. And let's be honest, there's a lot of money behind our healthcare decisions. You know, again, I joked about cholesterol medication. It used to be 250 was high. Well, then the drug companies, with their hired doctors on their payroll, decided 200 is now high. Well, guess what happened to the number of statin meds sold? I mean, anything you want to chase, you just got to chase where the money is. And, you know, unfortunately, there's more money in people being diseased and sick than there is in prevention. You know, an ounce of prevention is worth a pound of cure. Well, if that pound of cure makes money, or, you know, there's going to be more money with that, or the chase.
Right.
Yeah. So.
And from a patient standpoint, building on that, it's not only the quick fix in terms of time, but if I go into the doctor, I pay a $20 copay visit, I get a prescription that'll last 30 to 60 days, and I only pay a $10 copay there. So now all of a sudden I'm taken care of for 2 months, just $20 out of pocket. Which, you know, and if I go to see somebody like you, it may cost me a little bit more out of pocket, but so that's, again, another part of the system that is a little bit backwards, or a lot backwards.
Sure, it is. And, you know, in my practice, we're basically out of network. I don't, you know, I have a lot of, I know there's a few things. I know the value of what we're offering people, and essentially I don't let, at the end of the day, insurance companies, I might make some folks mad, but do not care about your health. And I know we all feel a little bit entitled because we pay such high premiums. But the problem is, at the end of the day, your insurance company does not care about your health. I mean, they have full-time staff that are hired to essentially deny claims, make sure claims are prolonged in payment, or look for any reason not to pay someone's claim. So, you know, it's just like your car insurance. I pay that every month, but I've never had them once pay for my maintenance or my oil changes. But I know in my car's best interest is to take care of it. So, you know, your health is your greatest asset. You know, Steve Jobs that guy was set, and, you know, and he got cancer, and you know, it doesn't matter how much money you have, if you don't have your health, any relationship you're in or anything you do in this life, you're not going to get to experience that. So I always tell patients, you know, don't put you know, the goal is to take care of your own health. At the end of the day, no one cares about your health more than you. And as you know, Scott, our health affects everyone in your life, your children, your spouse, your significant others, your relatives. So, yeah, you may have to pay more up front, but again, what's your health worth to you?